A very good morning. I am Dr. Sidhharth David, Senior Lecturer, Department of Public Health Dentistry, and I'll be talking about the various methods of payments in dentistry, that is, finance in dentistry. The contents include introduction, terminologies, different payment mechanisms, fee for service, post-payment plan, private third-party prepayment plans, commercial insurance companies, non-profit health service corporations, Delta dental plans, Blue Cross Blue Shield, prepaid group practice, including health maintenance organization, capitation plans, salary, public programs, conclusion, and references. Introduction. Dental plans are contracts between the sponsor, an employer or organization, and the third party, an insurance company, according to which you can arrange a dental treatment into the most suitable pattern. Usually, dental insurance plans do not cover the full cost of dental care. Dental care programs have some provisions that limit the amount the insurance company will pay. An average dental plan covers 100% for preventive measures, 80% for basic dental work, and 50% for major procedures. Basic dental coverage falls into three major categories. They are preventive and diagnostic dental care, basic dental care and dental procedures, major dental care. Preventive and diagnostic care. Nearly all dental insurance policies cover basic dental services such as checkups, x-ray pictures, cleaning, and some other procedures preventing tooth and gum disease. Since regular dental care prevents more serious potential problems, such coverage can be rather important. Basic dental care and dental procedures. Basic dental procedures include fillings, fixing chipped teeth, tooth extractions, periodontal treatment, root canals, etc. However, with some dental insurance providers, some procedures cannot be listed as basics, for instance, root canals. It is up to you to select a dental insurance provider who covers most items of basic dental care and dental procedures. Major dental care. It includes major dental care, usually includes dental surgery, denture work, orthodontics, and other serious expensive dental procedures. Some dental insurance plans cover a portion of major dental care costs. Terminologies. Co-insurance is a fixed percentage of charges the insured has to pay in order to cover dental treatment services. Co-payment is the dollar amount of the fee the insured has to pay to the dentist after the insurance company has paid a certain percentage stipulated in the contract. Deductible is a fixed dollar amount that a policyholder is to pay each year before the dental plan begins to pay for basic, restorative, and orthodontic benefits. Direct reimbursement plans is a dental insurance plan that is usually entirely funded by the employer and allows the insured to see any dentist of his or her choice without any network restrictions. Fee schedule is a list of fees a dentist is expected to charge for certain dental care procedures, which determines a specific amount your insurance provider reimburses you for your dental care expenditures. The fee schedule is stable and unrelated to a particular dentist's fee. Indemnity insurance plans, also traditional dental care plans or fee for service plans, is a variety of plans that provide preventive, basic, major, restorative, and orthodontic dental coverage. With an indemnity insurance, you can acquire flexibility to choose the professionals you want to apply to. Non-participating dentist is a dentist who has not signed any contract with a network of providers to accept participants of a certain dental plan under stipulated conditions. If you choose a network-based plan, you will have to pay comparatively a lump sum applying to a non-participating dentist. Participating dentist is a dentist who assigns a contract with the insurance company and agrees to provide dental services and supplies to eligible participants at a fixed price. Premium is the money amount one is to pay on a regular basis so that the insurance company could fund your dental plan. Provider is a licensed plan approved dentist, usually customary. Reasonable fee is a fee associated with each dental procedure, which reflects the fees charged by the majority of dentists for the services in question in a given area. The UCR fee can help you determine whether your dentist is charging too much. Third party payer is an organization other than the patient, first party, or healthcare provider, second party, involved in the financing of personal health services. Table of allowances is a list of covered services with an assigned dollar amount that represents the total obligation of the plan with respect to payment for such services, but does not necessarily represent the dentist's full fee for that service. Prepaid dental plan is a method of financing the cost of dental care for a defined population in advance of receipt of services. Preferred provider organization is a formal agreement between a purchaser of a dental benefit program and a defined group of dentists for the delivery of dental services to a specific patient population as an adjunct to a traditional plan using discount fees for cost savings. Indemnity plan is a dental plan where a third party payer provides payment of an amount for specific services regardless of the actual change charges made by the provider. Payment may be made either to enrollees or by assignment directly to dentists. Schedule of allowances, table of allowances, or reasonable and customary plans are examples of indemnity plans. Mechanism of payment for dental care. It includes fee for service, post payment plan, private third party prepayment plans, commercial insurance company, non profit health service corporation, Delta dental plans, Blue Cross, Blue Shield, prepaid group practice, including health maintenance, organization, capitation plans, salary, public programs. Now we'll be talking about fee for service. Private fee for service is also called as two-party arrangement, is a traditional form of reimbursement for dental service. In this system, the patient takes an appointment and the dentist suggests the appropriate treatment and informs the patient his fee for the service. If the patient accepts the recommended treatment and receives the services of the dentist, then he is responsible to pay the fee. By 1980, there was a fall in this method of payment, although still the most common method due to substantial growth in various other forms of payment for dental services. Advantages: it is culturally acceptable. Most common method of doing business. It is flexible. The dentist can modify his fees according to market condition and can also practice price discrimination. Administratively simple, the dentist may not always keep a written list of fees for various procedures. Disadvantage: there are many patients who, due to cost of treatment, may still not be able to afford the treatment under this method of payment. Post payment plan. It was first started by local dental societies in Pennsylvania and Michigan in late 1930s. Under this plan, the patient borrows money from a bank, finance company to pay the dentist at the appointment when agreement to receive the care is made. After the application is approved by the bank, the entire fee is paid to the dentist. The patient then repays the loan in the budgeted amount to the lending institution. This type of payment plans were developed with the hope that budget payment plans would bring the benefit to a large number of the population for routine dental care. But it was utilized more by middle income group rather than low income group and was used primarily for prosthetic treatment. The problems associated with it were the defaulted loans and the low income group people were not easily accepted credit worthy by banks. Payments by credit cards have restricted the post payment plans. Private third party prepayment plans. Third party payment is defined as payment for services by some agency rather than direct by the beneficiary of those. In this, the dentist and the patient are the first and second parties, and the administrator of the finances is called as a third party. Third party is also known as the carrier, insurer, underwriter, or the administrative agent. Third party is defined as a party to a dental prepayment contract that may collect premiums, assume financial risk, pay claims, and provide administrative services. Prepayment is a mechanism to distribute the financial load of dental care over a group. Virtually all of those covered can reasonably expect to make a regular and somewhat predictable use of the benefits. It is in contrast to insurance, which involves a group of people making small payments in order to cover the risk of a few suffering a catastrophic loss. It is expected that very few of them will ever suffer such a loss, and therefore most will never collect any insurance benefit. The purchaser of this type of plan can be organized private group, a union, or it can be an employer, a governmental agency, or a union employer welfare fund. When government act as a third party, the term commonly used is public financing of care. In private third party plans, premiums are collected to meet the cost providing care as well as the administrative cost of the third party. Reimbursement of dentists in prepayment plans. UCR fee method. The American Dental Association prefer the usual customary and reasonable fee method for reimbursement for dentists in prepayment plans. Usual fee, the fee usually charged for a given service by an individual dentist to private patients, that is dentist's usual fee. Customary fee, when the fee is in the range of the usual fee charged by the dentist of similar training and experience for the same service within the specific and limited geographic area. Reasonable fee, a fee is reasonable if it meets the above two criteria, or it may differ from dentist's usual customary fee if justifiable in the opinion of the responsible association, considering the special circumstances or for the particular patient in question. We will continue with the lecture in the second part.